Hey mama, welcome back to Mum Day. Today's workout and movement session is going to help to target lower back pain that you might be feeling during pregnancy. And this can happen for a number of reasons, but we're going to work on mobility and then stability to hopefully relieve any lower back pain that you are experiencing and make you a little bit more comfortable as you progress through pregnancy. I am currently 26 weeks pregnant, but you can do this at any stage of your pregnancy. We don't need any equipment for this session, but I do have a chair with me. You can use a chair, a couch, a weight bench, anything that you have at home, like an elevated surface. So when you're ready, let's jump into it. So we're going to start down on the floor with our mobility portion of this movement session, and we're going to start in a 90-90 position. So we're looking for a 90-degree angle with that front leg and a 90-degree angle with that back leg. And then we're going to think about squaring off our hips and our shoulders, sitting up really nice and tall through the spine, and then hinging at those hips, leaning over that front leg, coming into external rotation with this front leg, and then we're going to lean over and shift our way over this back hip for internal rotation of the back hip. And then we're just going to keep switching and flowing between these two. Just want you to keep nice passive breathing here, so avoid holding your breath in any of these positions. Just keep breathing to release tension, breathing into your back, breathing into your hips. And like I said, we're just going to keep switching between these two. Nice. And then I'm going to place my hands behind me and I'm going to switch my legs over to the other side. So I'm at 90 degree at the front, 90 degree at the back. Again, internal rotation with that back leg, external rotation at the front. Sit up really nice and tall, square off the hips and the shoulders, and then hinge. Feel that really nice stretch as you hinge over that front leg. And then lean that weight over the back leg. Noticing if one side feels any different to the other side. Maybe you have a little bit more tightness in one side, and then I just really want you to breathe into that tension. Try let your body be heavy, relax into it, release your jaw, release your abs, release your glutes. Just allow your body to release tension. Nice job, mama. And then we're going to come into an all fours position. We're just going to work through some cat-cows. So we're going to have our wrists directly underneath our shoulders and our knees directly underneath our hips. You're going to inhale, drop your belly down, lift your tailbone and lift your gaze, coming into your cow. And then we're going to reverse that. Tuck the tailbone, rounding through lower back, mid back, upper back. Think about pushing the ground away to create space through your shoulder blades. Tuck the chin. And then just drop that belly, inhale, lift the tailbone, and you're just gonna flow through those two movements, flexion and extension of the spine, just with your own breath. Finding as much range of motion as you can here. Extension can feel a little bit funky on the abs as you progress through pregnancy, so we're not pushing into pain, but really want you to think about finding as much range as you can. Nice job. And then you're going to push yourself up to a kneeling position, a tall kneeling position. We're going to start with our right leg forward. So coming into a half kneeling now, and then I want you to think about tucking your tailbone under, and you should feel a really nice stretch at the front of the pelvis on the left side. And then if you want to, you can reach your arm up and over for a nice side body opener. Think about reaching up high, stretching through that side body, and then bending over that front leg. And so we're releasing the muscles at the front of the pelvis, the hip flexors. And really think about driving those hips forward and tucking that tailbone under. just keep breathing, deep inhales to find length, and then just passive exhales, let all that air out of your body. Nice job. Okay, back into our tall kneeling position, and then we're just gonna switch sides. So you're gonna then bring your left leg up, and again, think about tucking that tailbone under to find that really nice stretch on the right side. And then same arm as that back leg, so right arm up and over. And really think about pushing that pelvis through as you maintain that tuck of the tailbone, and feel how that increases the intensity of the stretch at the front of the pelvis. And again, just keep breathing. We're here for another 30 seconds. Keep reaching up and over with that arm if you're lifting the arm. Nice job, mama, and release. Okay, now we're gonna use our chair and we're gonna come into a plank position, so an elevated plank. So we're gonna start with our shoulders over our wrists, and then you're gonna think about hugging your baby in. So I want you to inhale, nice, fill up those ribs, and then exhale, zipping up from pubic bone up to belly button, engaging those lower abs, that transverse abdominis with your exhale, and then you're gonna step your feet back. And from here, you're gonna maintain that core engagement. We're just gonna march the knees up towards the elbows. Really nice and slow and controlled. Keep breathing here, but maintain that core engagement. Working on our deep core muscles here. And think about having a really nice straight line from the crown of the head, through the rib cage, through the pelvis, and out through the heels. Now, if this is too intense for you, you can do this against a wall. The further away your feet are from the wall, the harder it's gonna feel. So you choose a variation that suits you. Nice job, mama. Okay, now we're gonna place our back on our chair, and we're gonna come into some elevated glute bridges. So I'm gonna start with my upper mid back on the chair, and walk your feet out. We're looking for a 90-degree angle with the knees. Same thing, I want you to think about zipping up from pubic bone to belly button, hug that baby in. You're gonna drop your hips down, hinge and keep your chin tucked. Inhale here, and then exhale. Push the ground away through the feet to lift the hips. Full extension of the hips here, and you'll feel that amazing glute contraction. Inhale, lower, exhale, drive those hips up. Feel those glutes working in that top position. Keeping that chin nice and tucked. Nice job, mama. One more hold at the top. Hold, 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 extend the hips. Feel those glutes working, and then slowly lower with control. Nice job. Okay, we're gonna stay down on the floor. I'm just gonna move my chair out of the way, and we're coming into a modified side plank here, again for a little bit of core and hip stability. So we were looking for our elbow directly underneath our shoulder, top hip stacked over bottom hip, top knee stacked over that bottom knee. We're gonna take a big inhale here. Exhale, again, hug that baby. So think about engaging those lower abs like you're zipping up a tight pair of jeans. And then we're gonna exhale, push our knees into the ground to lift our hips forward and through. And we're looking for a straight line from the knee through the hip and the shoulder. And then we're just gonna lower down and then push back up. Lower down slowly with control, and then exhale, push those hips up. Nice job, mama. Nice and slow and controlled. Working the glute med. That's going to help to support and stabilize the pelvis and the lower back, and hopefully relieve your symptoms of lower back pain for long-lasting relief. Okay, nice job, mama. We're just going to go ahead and swivel over and do that on the other side now. This is the last movement of our stability section, and then we're going to go back to mobility. So just check your alignment again with your hips, your knees, and your shoulder. Think about lifting up through that side body. Take your inhale. Exhale, engage that core, so hug that baby in. Push the knee into the ground to lift those hips. Nice job. Inhale, lower. Exhale, push the hips up. Nice job, mama. We're gonna go for 2 more of these lower and lifts. So last one here. Nice job. Lower yourself down. Okay, we are gonna come back into that half kneeling position. I'm gonna start with my left leg up. And what you can also do with this is come against a wall and push your knee into the wall. And then we're just gonna go for some thoracic rotations on that left side. So same arm as the leg that's lifted. You're gonna rotate, drawing big semicircles from that knee and then behind you. And here we're working on thoracic mobility. So mobility of the upper mid-back, which we can often lose mobility in the thoracic spine, which can cause our lower back to increase its mobility, and the lower back wants to be stable. So by working on the mobility of the thoracic spine, it can help to stabilize our lower back, reduce movement, and make it feel less achy. Nice job, mama. Let's go for 1 more. And if you're not using a wall, then you're just gonna go ahead and switch. I'm gonna turn myself around and press my right knee into the wall, and then rotating with my right arm, finding that nice big range of motion through the thoracic spine. And again, just keep breathing with this. Last couple here for these openers. Nice job, mama. And then final movement of this flow, we're gonna come into a prayer stretch. You can do this from a chair, your couch, a countertop. You can do this multiple times throughout the day. It feels amazing. We're gonna place our elbows onto the chair. You're gonna keep your bum up really nice and high, and then you're just gonna sink your chest and your head between that gap between your shoulders, coming into an extended position through the thoracic spine, bringing your hands behind your head. You can even roll through some little pelvic tilts here, getting some movement, whilst also keeping that nice extension through the thoracic spine as you drop your belly. And again, mama, just keep breathing. Last couple minutes, last couple reps here. and release whenever you are ready. Well done, mama. Like I say, you can do this routine daily until your symptoms of lower back pain start to improve. Thank you so much for joining me for that quick lower back relief flow. I'm really looking forward to seeing you in our next session together. Bye, mama.